Okay, so I just wanted to real quickly go over some of the focused assessments on your postpartum patient. We talked about in the classroom how you will, still assess and auscultate lung sounds, anterior and posterior. You're still going to auscultate the heart tones. You're going to auscultate vowel sounds. But then you're going to have a little bit of a more focused assessment when you're at the abdomen. And on your postpartum woman, one of the leading causes of death in the postpartum period is a postpartum hemorrhage. And so we want to make sure that we're very proactive on assessing our patient's fundus, making sure it's nice and firm. We want to constantly be assessing how much vaginal bleeding or lochia that they're having to, therefore we can intervene quickly if we need to. So I was kind of trying to explain to you in the classroom how to palpate a fundus, but I just wanted to show you real quick on this half of a person. And you guys are more than welcome to any time to come in here in the lab and kind of practice palpating this fundus and feeling the differences. So right now in this woman, I have a fundus that would be boggy. And you see how it's real squishy and easy to kind of, push around on? This is a boggy uterus. And this would be cause for concern. Whenever the uterus is not contracted and clamped down, it allows those blood vessels that are exposed to open up and bleed. And so in this boggy uterus, or the soft uterus, there's nothing there compressing and contracting the blood vessels to prevent the woman from having a heavy bleed or hemorrhaging. So we want the size, don't get mixed up on the size, it should still be about this big. But you can see how this fundus is nice and firm. It's firm, it's contracted, and therefore it's constricting any open blood vessels and preventing a hemorrhage from occurring. But since this one's bigger, we'll use it to kind of practice finding the fundus. We talked about in class how we kind of use the umbilicus as our guide. And so on here, I'm going to take my left hand, and I kind of like to support the lower abdomen of the woman. And then I take the side of this hand, and I just kind of go around and I push, trying to palpate that nice firm uterus. And the top of it, which is the fundus. And I find that the top of it seems to be right here, right level with the umbilicus. So I would determine that as being UU. The uterus or the fundus is equal with the umbilicus. If it was lower than the uterus, let's say if it was about, this one would be about 3 finger widths below the level of the umbilicus. So if this was the case for my postpartum woman, I would document this or report this as U3, meaning that the uterus is 3 finger breadths below the level of the umbilicus. It could also be above. If it was above, then the number comes first before the U. So if it was way up here, I would communicate that or document it as 1U, or 1 finger breadth above the level of the umbilicus. So that's how you'll palpate your uterus. Normally, immediately postpartum, after a delivery, we're checking the fundus about every 15 minutes for an hour. Different facilities might have different protocols on that, so you'll just have to make sure that you understand the protocol at the site that you'll be attending. And in addition to that, we need to be checking for lochia. And we talked a little bit about the different types of lochia. You have to kind of research that and make sure you come to clinical prepared and put that on your ticket. There's rubra, there's serosa, and there's alba. And you want to make sure that you're kind of staying on top of how much bleeding your woman's having and how heavily she's saturating her perineum. So after I have assessed my fundus, I just kind of come down here real quick. It doesn't have to be, extremely embarrassing or invasive on the patient. You just want to pull down their underwear and just look at the labia. This one looks, maybe a little bit swollen, so I would ask her if she was having any issues and any pain and maybe offer her an ice pack or Tux pads or something to kind of help decrease the swelling. If she had any suture repair or hemorrhoids, then I would kind of roll her over on her side and get out a flashlight and look at those sutures and the repair to make sure that the stitches look like they're intact and not bothering her any, and check them for the presence of any hemorrhoids. In addition, from then on out, we're just going to go on down like we would any other assessment on an adult. We're going to be looking for the presence of edema and swelling. We're going to check pedal pulses, and we're always going to end with checking for the Homan sign. In addition to that, like we talked in class, we're going to assess her breast. If she's not breastfeeding, we will ask her if she feels like her milk's coming in or if she feels like her breasts are filling up or getting engorged. If she is breastfeeding, then we want to make sure that we do actually look at her nipples to make sure that they're not getting broken down or irritated. We want to watch the process of the mom latching the baby on, and then we want to watch that feeding process as well. And then you, of course, in addition to that, you'll get your vital signs every 4 hours, your complete set of vital signs. We're going to be assessing her frequently for pain. It's very common for women to have some cramping and contractions after they have their baby. If they had a bad tear, then they're probably going to have some perineal pain. So we want to make sure that we're staying on top of that as well. Again, just like the newborn assessment, you can go on YouTube and go and find some in-depth head-to-toe assessments for your postpartum woman. Your clinical instructor will kind of be leading the way on this assessment, but make sure you're in there as much as you can and asking the instructor lots of questions. Okay, good luck.